Every day as a physical therapist, I'm reminded of the repercussions that come with having diabetes and how important it is to manage it as well as you can. People don't just all of a sudden wake up one day and lose their foot. It's a process that happens. And once something that dramatic happens, it changes your whole life. People can overcome that, but the amount of impact that that has on your life is devastating. And the truth is that diabetes isn't just about blood sugar. It's about what it does to every organ in your body. And it has an effect on every organ in your body. One of the reasons that diabetes affects so many organs is because diabetes affects your blood vessels, and especially the smaller ones that are in your hands and feet, in your brain, in your eyes, in your kidneys. And although a lot of people don't notice these little changes, as they add up, all of a sudden something reaches a threshold where there's enough damage that's been done that it starts to show. I work with people all the time who started out with a wound on the bottom of their foot. And because diabetes affects the circulatory system and because it affects the nerves, so it leads to something called neuropathy, where people can't feel the sensation through the bottom of their feet. So those two things, the tendency because of the circulation to get wounds, and then also the fact that neuropathy leads to decreased sensation. They don't always feel the pain that we usually associate with wounds. So that wound might sit there and get worse and worse and worse. And when this happens, people often lose maybe a toe, and then often the wound keeps going because the circulation isn't good enough for good healing. They lose half a foot, and then they lose their foot, and then they lose below their knee. And the impact of losing even just one toe is huge because it affects your ability to walk. It affects your ability to put weight on that foot. Usually there's a weight-bearing restriction until the wound is healed. And so if you can't put weight on one of your feet, that has huge impacts on your ability to be independent. And in the place that I work, one of our biggest goals is to help people to get home. If somebody has stairs and they can't put weight on one of their feet, it makes it really difficult to be able to do stairs unless the person's able to use a crutch and a railing, or they're able to go up on their rear end. But that's really hard, especially for older people. So the best thing that we can ever do is try to limit the damage that diabetes is doing before that damage starts to become evident to us. And that means that as well as possible, that you or your elderly parent manage your blood sugar levels where the doctor wants it to be. But it is possible that your loved one, your mom or your dad, is going to say, I don't care. I don't care what happens. And I think that as long as they understand the consequences, like that might mean, Mom, that you lose your foot. And then how are you going to be able to keep walking with your walker? How are you going to be able to stand up and go from your wheelchair to the toilet? All of those things are going to be a lot harder. I think the best thing we can do sometimes is to just give the potential outcomes to a situation and then let our parent make the best decision they can. And as a caregiver, if you're trying to have that conversation with your parent and they're acting like, or they're saying things like they don't care, they're still going to eat whatever they want to eat, it's a good time to bring up the idea that you might not be able to be the one who's doing all their care if they lose their foot or if they lose their limb below their knee. It's going to take a lot more to do everything if that becomes the case. And so for them to be able to see that and understand that can hopefully also decrease your guilt that you might feel if something like this suddenly happened and you were in a situation where you had to say, I can't do this anymore. At least there's in your parents' mind, hopefully, an idea of what the future could look like if they continue to not care about what they're eating or to not care about monitoring their blood sugar.